Well, hello and welcome. I'm glad that you were able to join us today. Please do take a moment to type your name into the chat as a way of verifying your attendance for the continuing education, of which you will get 1.5, 1.5 contact hours for the presentation today. Okay, so launching ourselves into it. We're going to be talking today about unlocking the spirit from the realm of hungry ghosts, looking at trauma responsive care for co-occurring disorders, particularly the co-occurring disorders of substance abuse and a history of trauma. And those two often dovetail in ways that are very harmful to our folks. So my name is Mike Bricker. I am a mental health clinician, certified alcohol and drug counselor. I'm part of the STEMS Training Institute. We are a NADAC approved education provider, which means that our CE hours are approved for recertification and license renewal for drug and alcohol counselors, for LPCs, LCSWs, and psychologists in the state of Oregon for sure, and perhaps in other parts of the country where you come from as well. So the title obviously comes from the incredible book by Dr. Gabor Mate called In the Realm of Hungry Ghosts, Close Encounters with Addiction. He is a psychiatrist who works in British Columbia and has spent many, many years working with chronically unhoused persons with IV drug problems, street people, basically, among many others. He has many wonderful trainings out there. But in the Hindu and Buddhist traditions, the hungry ghosts are called preta. They're tortured spirits. They're untethered spirits that wander around in our reality, undergoing suffering that's greater than that of normal human beings, and with particularly this unquenchable level of hunger and thirst. They may look like angels, but they're hungry ghosts just the same. In other words, particularly for substance abuse, it looks like such an attractive way of dealing with the after effects of trauma. And as often happens, what used to be the solution has now become the problem. So quickly, a couple of housekeeping things. For those of you who are at the live event, most importantly, at the end of the training, you have to follow some instructions on the final slide in order to get your CE certificate. If you're watching the recording, unfortunately, you won't be able to get the CE credits because they're not approved. But if you would, type your name in the chat box anyway, because I'd love to know that you're here. If you have questions as we go along, please type them into the question and answer box. We'll have some discussion time at the end if we have time, and if we don't, then I will give you a written response to the questions that are raised. Just a reminder, it's the honor system, but you got to attend all the way to the end in order to get the CE credit. So glad you're here. Let's launch ourselves into this. One way of looking at the experience of trauma is something that happens too much, too fast, and too often. Things that just overwhelm the individual's ability to cope. The allostatic load of the event completely overpowers their nervous system and brings in the fight, flight, freeze, or befriend, the four basic trauma responses. For our purposes today, we're going to deal with something that's a little bit different. We're going to be dealing with complex trauma or trauma that derives from experiences in childhood, particularly issues of childhood abuse or neglect, physical, emotional, sexual abuse, and also cultural and intergenerational trauma, and ways in which the experience of prior generations can sensitize a newborn's nervous system to be more susceptible to the effects of trauma. So basically what we're talking about is developmental trauma. There are some healthy coping mechanisms for adults. We all know about this, but many of these weren't available to children when they were undergoing these developmental insults in the form of some kind of traumatic experience. So it's important to recognize that we're really dealing with two different types of reactions. One of them, obviously, is the immediate reaction. That's the fight, flight, freeze, or befriend response that happens in its immediacy. But often, and particularly when the trauma happens over and over and over again, these then become ensconced or emblazoned into the nervous system. And these then become the delayed reactions that are so troublesome to our patients, our adult patients, by the time that they come to see us, that these things have basically, like shipworms, they've kind of burrowed into the nervous system, and they're in there and causing them problems today, even though the trauma may have happened a long time ago. We're all familiar with Maslow's hierarchy of needs, very useful stuff. I like to use Erikson's stages of personality development. I use these with patients. They seem to kind of get this way of looking at how our personality develops. Particularly, we're going to be looking at these three first stages, basically from in utero or conception to the ages of about 12. Yes, these things can in fact happen in utero if a woman, for instance, is in a highly anxious or abusive relationship where her fight and flight stuff is getting triggered all the time. All of the same chemicals that are driving her crazy are washing through the baby. And so it's possible for babies to become sensitized in utero to the effects of trauma. And the converse is also true. And that is that in utero, they can also learn self-calming, self-soothing behaviors. For instance, in many native cultures and other cultures as well, mothers will sing to their unborn child. They'll tell them stories. And so that helps the infant to develop the calm and the rest and digest part of their autonomic nervous system as it's developing. So we're going to talk about the Adverse Childhood Experiences Survey, or the ACEs. Been around now for quite a while. The major study was done in around 1995 and published just before the turn of the 21st century rather. They looked at about 17,000 adults, and it's important to remember that these were regular outpatient medical clients. They were not behavioral health clients. We tend to look at this in the context of behavioral health because we're behavioral health clinicians. These were people who came into a regular outpatient medical clinic or hospital clinic for diabetes, for birth control, for heart problems, for MRI imaging, for knee replacements, all kinds of things. What they were looking for treatment failures. They were looking for people who, for whatever reason, brought them in, particularly with chronic conditions. What was it that caused them to drop out of treatment? And what they discovered is that there were 10 things that really seemed to be highly correlated with those kinds of unpleasant outcomes medically. They discovered that they're really common and that they're actually very robust predictors, not only of later behavioral health problems like drug and alcohol abuse and stuff like that, but actually chronic medical problems like heart disease, diabetes, high-risk health behaviors, and a highly increased risk of chronic disease and early mortality. In fact, if I remember the statistic correctly, people who have 4 or more ACEs are likely to have their actuarial life expectancy shortened by up to 5 years. So it has a really, whether they develop behavioral health problems or not. Felitti, who is one of the authors, says that it's the leading determinant of health and social well-being of our nation, which is I think a reasonable statement. So how does this? What's the problem with this coping with childhood stress? Normal healthy coping progresses something like this. There are environmental stimuli. There are, for an infant, for instance, hunger. When the environment, the person's internal environment, presents with the experience of hunger, without even thinking about it, the child kind of does it an instantaneous idea of, is this positive or irrelevant, or is it dangerous? It's dangerous because I don't feel good. I'm really hungry and it's uncomfortable, which leads to a secondary appraisal. Are the resources available to me? If I cry, will somebody come to feed me? So if there are insufficient resources, in other words, life experience has taught me that if I cry, nobody's going to come. Nobody's going to come to feed me. Nobody's going to come to pick me up and coo at me and love on me and change my diaper. So then what happens is, in some cases, that results in these maladaptive stress responses that are beneath the level of conscious awareness. They're not something that I decided to do necessarily. Sometimes they are. So what does this do? Well, repeated insults to the nervous system of this type tend to really interfere with the development of regular and effective cognitive appraisal and emotional coping skills. They don't really develop, which leaves the child with a great deal of confusion and a great deal of dysregulated responses to stress. So this is the diagram that came out of the adverse childhood experiences thing, that these experiences result in social and emotional impairment and the adoption of high-risk health behaviors, including things like overeating and diabetes and all these kinds of things, which lead to disease, disability, and social problems, which tend to result in early death. Looking at a broader context, we begin to look at historical problems, historical trauma, and the ways in which those things become embodied in the person's body. We have the complex drama that results from having multiple adverse childhood experiences, which results in this allostatic load, this workload on the nervous system to cope with this, which disrupts the neurological development of the child, which leads to these dysfunctional early coping skills, and again, resulting in early death. Well, why does this complex trauma act any differently than this complex trauma? Well, the fact is that there is a historical, cultural, and epigenetic loading. The adverse childhood experiences, the traumatic experiences of past generations, cause epigenetic alterations in how genes are expressed. It doesn't change the genetic makeup. It doesn't make people who have genes for brown eyes have blue eyes. But what it does is it helps people who have blue eyes learn to hate people who have brown eyes. And how this shows up is in these microaggressions and implicit bias that we're just not conscious of. We're just, it's beneath, by definition, implicit. We're not aware of it. So this is one of the things that makes it extremely difficult when we are conceptualizing from, in my case, a white middle-class European point of view, to understand the experience of an African-American person or a Native American person, because I simply don't share that experience. I don't have that epigenetic load. I may have a different kind of epigenetic load in my case for substance abuse, but that's quite different. So the ACEs survey, this is a version of the ACE survey. It's one that I developed when I was working in Alaska, working with Alaska Natives. And I made a couple of alterations to it. These are the 10 things that were identified in the ACE study. There was no change there. And the descriptions of them are word for word the way that they were expressed in the original screen. But I made a couple of changes. Going back to that idea of the first 3 developmental stages of Erikson, the original ACE study looked at birth to 18. When I'm working with people who have an acute trauma or even sometimes repeated episodes of acute trauma that happens to them in their late teens or early adults, domestic violence being an example, perhaps, or sexual abuse, terrible. I mean, it has a terrible impact on that person. But by the time that they get to be teenagers, by the time that they get to be adolescents and young adults, they have developed certain coping skills. They've developed some life experience. They've picked up some things that can be helpful to them in managing that trauma load. 6-year-olds don't. And the thing that keeps coming up for me over and over and over again in the people that I work with, age 10 keeps coming up over and over and over again. And when you're 10 years old, you cannot possibly understand that when your mother comes in, you're a 10-year-old boy, and your mother comes in and she's, her boyfriend has just, slapped her in the face and left. And she says, you little shit, you're going to grow up to be just like your dad, and you're probably going to get some girl pregnant and leave her like he. I don't care how smart you are at age 10. You can't realize that that's not about you. That's mom's pain that's slopping over onto you. But when you're 10 years old, everything is about you. I mean, your job is to be the center of the universe. And so we take that in, even though it's not ours to carry. So that's why I changed this from birth to 12 years old. By age 12, most kids are reaching that developmental stage. They're coming out of that concrete operational stage of childhood and beginning to develop, the frontal lobes are beginning to develop, and they're kind of beginning to learn how to abstract and how to think about things in a different way. So before about age 12, many of the coping skills that would be most helpful to them simply aren't online yet. I don't care how intelligent you are. So that's why these alterations to the survey. The first thing that I do is I ask them to identify some strengths about themselves. Many people have told me that this was the most difficult part of doing the survey. They know about all this crap. They know what happened. What they have lost track of or lost sight of is the strengths and resilience that help them to survive. And often one of the questions that I'll ask is, tell me how you survived this. Tell me how you kept this from getting any worse than it did as an adult. And so I want to know what are their strengths. And also I want to know what their age is now, just because it's helpful in knowing what kind of an approach to take with them. And the original ACE survey simply had this column here. Either it did happen to you or it didn't. That seemed like kind of a one-sided view to me. And so I added this other thing of, okay, so what didn't happen to you? What are the things that could have happened to you that didn't? And that's not really a resiliency score, but for want of a better word, this is about the checks and balances of these things. And then looking at, okay, did these things happen to you or did they not happen to you? And you can total those things up. Now, the third thing is, though, how is that affecting you now? For instance, I happen to be a survivor of sexual abuse. Happened to me when I was a little bit older than this. I was in my early teens. Happened one time, not a hugely formative experience for me. I've done my therapy around it. No, it's not my fault. Don't think about it, except every time I do this darn quiz. However, some of the emotional abuse and the neglect, the withdrawal of affection as a way of punishment, boy, that happened when I was way younger than that. And if I'm not careful, every once in a while, it sneaks up and bites me in the butt when I'm not looking. So the experience of sexual abuse for me might be kind of a 1, but some of the other things like emotional neglect and abuse, maybe a 3. So, and again, that helps them to look at this not as a light switch, everything's a 10. No, there are some things that had less of an impact and some things that had more of an impact. And then looking at, okay, so how are the things that have shown up? How has this shown up in your life today? This particular version seems to be slanted towards residential drug and alcohol treatment because that's where I've spent most of my career. And the most valuable thing that I find about this is that it opens a conversation. I don't give this to people. This is not part of the intake paperwork because that's much too overwhelming. We do this together and I explain to them the way that I did to you. And it really opens a conversation and it helps to normalize the experience and to know that they can talk with someone about this without shame, at least hopefully without shame. So how do these ACEs, these higher ACE scores show up? Well, people who have 4 or more ACEs look at the ways, really, depression, anxiety, drug and alcohol use. Okay, got that. Risk for HIV disease and other bloodborne pathogens like hepatitis C, almost 60% increase. Feelings of chronic hopelessness and life dissatisfaction. Cardiovascular disease and cancer, 25% increase in the risk for that. And mental health conditions and disturbances resulting in lost work days. Huge impact on society, not just on the individual. So it's important to remember, and this is where mindfulness becomes so important. By definition, trauma is always other when. By definition, trauma, post-trauma is not happening now, by definition. It just feels like it's happening now. So complex and intergenerational trauma begin to compound whenever the individual's developmental coping mechanisms are no longer sufficient or not yet sufficient to manage the allostatic load, the workload on the autonomic nervous system, not the conscious nervous system, the autonomic nervous system. So the solution then is to help our patient develop coping skills to deal here and now with the echoes of happened back there, back then. And that gesture is very deliberate. I always do that when I'm talking about this, because what I'm doing is I'm making a visual break between today and yesterday. This is the other side of that ACEs score. The ACEs quiz, they go together. This is the Connor-Davidson resiliency scale. And again, what I'm trying to do is to help the patient develop a sense of balance. The experience of trauma tends to leave people living in the donut hole. They're always looking at what's not there. There's no sense of ease. There's no sense of relationships. There's no sense of support. There's no sense of hope that there's a way out of my drug or alcohol problem. There's no way that I can envision having a healthy relationship with a spouse. That's what's not there. But the hole in the donut is not the important. It's important. If it doesn't have a hole, it's not a donut. It's a fritter or it's something else. But that's not the important part. The ACEs help to look at, okay, what's the whole? What is it that's not there? The ability to cope with these things, but what is the rest of the donut? I have a college degree. I have a skill. In spite of everything that happened, I'm a journeyman plumber. I was able to become a grade school teacher. Beginning to look at the whole picture and not just the effects of the trauma. So, because this is a recording, the polling isn't available, but I think this is a worthwhile question to kind of ask yourself, and that is, do you currently use some form of the ACEs survey in working with your patients? Some people use it a lot. Some people use it sometimes, not all the time. Some people don't want to use it at all because they're afraid it can be too triggering for their patient. That's a legitimate question to ask. Some other folks, they're not sure what to do with the results, and so they don't use it very much. Or there are people who are really interested in learning in more effective ways to deal with it. So looking at some definitions, mindfulness. This is from Jon Kabat-Zinn, who is one of the prime movers in bringing this mindfulness techniques into the medical realm. Mindfulness is awareness that arises through deliberately paying attention on purpose in the present moment without judgment, as if your life depended on it. Which leaves us with a decision about mindful. Are we going to be mindful, or are we going to be mindful? That's our choice. Okay, so looking at a definition of mind, Webster says it's the part of a person that thinks, reasons, feels, and remembers. Perfectly valid. I think, especially looking at the autonomic nervous system and the energy systems within the human body, I think this is a more useful one. Daniel Siegel says it's a process that regulates the flow of energy and information. So a little bit of history. There have been ancient meditative and wisdom traditions for over 7,000 years. The number that's going to come up in a minute isn't quite accurate. But for instance, Buddhism, Zen, Sufism, Christian mysticism, the Hebrew Kabbalah, indigenous ceremonies for thousands and thousands of years have been used. Actually, about 7,000, not just 3. But they were always kind of esoteric. They were always kind of on the fringe until in the 1960s, Maharishi Mahesh Yogi really kind of capitalized on the popularity of the Beatles. And all of a sudden, these things began to move into mainstream culture and mainstream awareness, which resulted then in some research that led to the publication of a book called The Relaxation Response in 1976 by Dr. Herbert Benson, a growing awareness of movement meditation like Tai Chi and Qigong and yoga, and also Jon Kabat-Zinn, who was beginning to actually operationalize these techniques for use in the medical arena, not just the mental health arena. So where does the word mindfulness come from? The earliest example I was able to find was in the 1880s. It develops, and I'm not sure how it got there, but it develops from the Sanskrit word meaning awareness, or specifically coming back to awareness. And samatha is the Buddhist practice of calming the mind, done by practicing single-pointed meditation, for instance, meditating on a candle flame or something like that, and awareness of the mindfulness of breathing. This is that quote from Kabat-Zinn again. Another one is a little bit more medical, immediate experiences, and adopting this attitude of curiosity and openness and acceptance. Lots of research support for it. I'm not going to go into this in great detail, but there's a great deal of research that supports the use of mindfulness, not just for medical issues, not just for garden variety depression, anxiety, and substance use, but also for the treatment of complex trauma. For folks who like to have a more guided or a more manualized approach, there are a number of manuals. This is by no means an exhaustive list. applications for stress reduction, which is the medical thing, mindfulness, relapse prevention for substance use disorders, cognitive therapy, and both dialectical behavior therapy and acceptance and commitment therapy grow directly out of this tradition. So the general consensus is that there are 8 elements of mindfulness. And in looking at some definitions, the beginner's mind, this is the quality of awareness that sees things as fresh and new and with a sense of excitement as though we're seeing things for the first time. Being non-judgmental, not being able to observe what's happening without feeling the need to label or judge or decide if a sensation is good or bad, but simply noticing them in the moment. Acknowledgement, a quality of awareness that accepts and validates things just as they are. One of the keystones of acceptance and commitment therapy is things are what they are, not what they say they are. Non-striving is a quality of awareness that says you don't have to work at it. There's no need to move toward or away from any given experience or to be anywhere other than where you are right at this moment. Equanimity, a quality of awareness that enforces balance and fosters some wisdom and allowing a deeper understanding of what's going on rather than surface judgment. Letting be, a quality of being able to be with things as they are without having to move or escape or try to change them. Self-reliance, a quality of awareness that helps you see from yourself and from your own experience what is true for you. And then finally, the self-compassion, cultivating a love and respect and acceptance of yourself just as you are, without self-blame or criticism. Of course, Brene Brown is one of the gurus of that. So another polling question. Okay, so which of these mindful and meditation interventions do you use most with your patients? And you can kind of click any of those that apply. Again, this poll is not going to show, the results are not going to show up in this recording. Okay, so mindfulness, all of these approaches that we're going to look at incorporate 3 elements, either singly or in combination. One of them is breath work, bringing the focus of the mind to full awareness of the breathing in the here and now. Another one is meditation, allowing the mind to observe itself in the present moment without judgment. And then somatic awareness, being consciously aware of my body in this present moment. And, for our purposes, the Maharishi Mahesh Yogi's transcendental meditation is an exception. That's not to say that it doesn't work. It's a separate kind of a discipline, because you're working with a mantra that somebody else gave you, not to something that you come up with yourself. So, breath work. It's interesting when I do this in live presentations, when I've used this slide in live presentations, by about the second quadrant and sometimes into the third quadrant of that circle, the whole audience is breathing in unison. Because not only are they taking a cue from the slides, but they're also in polyvagal, the idea of neuroception, our awareness of the people around us, so the mirror neurons are, and eventually the whole group is breathing in unison. Kind of interesting. Okay, meditation. Meditation is useful for a couple of reasons. One reason is that it enhances the effect of some very beneficial neurotransmitters. Endorphins are the national pain relief and calming. Oxytocin is the feeling of bonding and belonging. Dopamine, of course, the rewards, and serotonin, which helps release tension and balance emotions. These are the positive things. Another thing that it does, though, is that cortisol is one of the most important stress hormones. We're all familiar with adrenaline. Adrenaline is one of the stress hormones, part of the fight or flight response. The thing about adrenaline is it goes up and it goes down very fast, right? If you've ever been startled, whoop, your adrenaline, all of a sudden the startle response and your breathing speeds up. Cortisol, though, rises much more slowly, but it stays around for a lot longer. It doesn't come down as quickly. So what happens is when you have repeated stressors, the cortisol level never really comes down as to like baseline to zero. It's always elevated. Cortisol causes inflammation. Cortisol causes many of the stress-mediated disease processes that we're aware of, things like irritable bowel syndrome, essential hypertension, predisposition to diabetes, and all kinds, and substance use. And so the key to resolving the stress response is to lower the levels of cortisol. There are two things, to my knowledge anyway, that have been demonstrated by research to lower serum cortisol levels. One of them is sex. Okay. The other one is meditation. Now, exercise can also, not to say those are the only two, but the thing about meditation is that it is entirely under your influence and control, and it works all the time. Now, we have some preconceptions about meditation that might be worth looking at. One of them is this idea that you have to be wearing a yellow saffron robe and spend 8 hours a day sitting on a cushion contemplating your navel. That's one form, no disrespect, but that's not essential. The idea that meditation is making your mind go blank, can't do it. It's impossible to think about not thinking about something, okay? For instance, whatever you do for the next 30 seconds, don't think of the word chrysanthemum. When I say it, you can't not think about it. So rather than trying to not think about stuff, I like the metaphor from acceptance and commitment therapy about my thoughts are like leaves on a stream. There's this gently flowing stream, and there are some thoughts that are coming down like leaves on this. Every once in a while, one will catch my attention, and I pick it up and I look at it for a minute, and then I put it down and let it go on its way. So it's not that. So there is, in the interests of full disclosure, there is one drawback to meditation. Sometimes it leaves you thinking about other stuff. But here's something that's a slight alteration from DBT called improving the moment with psychological flexibility. And I've been meaning to change this slide, and I haven't yet. When you're doing meditations, particularly guided meditation, it's wise to stay away from concepts or words like a safe place. People who come from the experience of trauma, there may never have been a safe place, or the places that they thought were safe turned out not to be. So I would stay away from that. A calm place, a peaceful place, a place where you can feel relaxed. Put the experience of the past into the context of your own values. What is this experience here to teach me? Rather than, oh, this is bad, this is terrible, this is painful, I got to stop this. No, what is this experience here to tell me? Prayer, the complete opening of yourself to the experience of connectedness with something larger than you are, whether that's a formalized expression of religion, whether it is a kind of a generalized, but the awe that you feel when you're looking up at the sky and you see all of those stars, and it's like, whoa, that feeling of being connected to something that is larger than we are, and oh, by the way, larger than our problems. Relaxation, being able to change and take control to effectively moderate how your body responds to challenges, particularly things like pain. Learning how to focus your entire intention on one thing in the moment, letting the experience flow through you without having to judge or label it. Taking time out to regress or reloop, to regroup. I forgot to mention in that earlier section, the idea of 6 hours sitting on a pillow. Research has shown that the ideal length of time for meditation seems to be right around 15 to 20 minutes. And the reason for that is if you're measuring serum cortisol levels, you have to go 3 times as long to double the benefit. So in other words, 15 minutes is good. To get twice as good, you got to sit for an hour. That's not a bad thing if you can do it. But most of us can find 15 or 20 minutes sometime in our day to be nice to ourselves. Now, here is a light stream meditation. This is one that's very commonly used. There are lots of information on the internet about it. This is one that's kind of short enough to fit into our experience today. So I would invite you just to relax for a moment.
Begin by concentrating on a disturbing feeling in your body. If the feeling had a shape, what would it be? And if it had a size, what would it be? Which of your favorite colors might you associate with healing? Imagine that this favorite colored light is coming in through the top of your head and directing itself at the shape in your body. Let's pretend that the source of this light is the cosmos. The more you use, the more you have available. The light directs itself at the shape and penetrates and permeates it, resonating and vibrating in and around it. As it does, what happens to the shape, size, or color? As the light continues to direct itself to that area, you can allow the light to come in and gently and easily fill your entire head, easily and gently. Now allow it to descend through your neck, into your shoulders, and down your arms into your hands, and out your fingertips. Now allow it to come down your neck and into the trunk of your body, easily and gently. Now allow it to descend through your hips into your legs, streaming down your legs and flowing out your feet. Just allow your body to reflect how you're feeling. Is there a word or phrase that represents what you're feeling? Do a set of DAS. Pause and notice what you're feeling. And do another set of DAS. Pause and notice what you're feeling again. Do one more set of DAS. And pause. Now you can come back to the room and open your eyes.
That was rather nice. No, somatic awareness, that's the third component or the third element of many meditative traditions. One of them is, of course, Qigong, which is a form of movement meditation. Much easier to practice in some ways, hard like any good practice to get good at, but relatively easy for folks to do. And a walking meditation is not just strolling. It's preferably barefoot and really being conscious and aware of every sensation of the blades of grass as they caress your footfall, being aware of the sounds around you and the feeling on your skin and all of those kinds of things can be very calming. It's interesting. Francine Shapiro, who is of course, the founder of EMDR, this was a part of how she developed her awareness of EMDR, and not formally through Qigong that I know of, but she discovered she was feeling anxious about a problem, and she discovered that when she walked, and she became aware of the rhythm of her walking, and she noticed her eyes were moving from side to side as she on the path. And that was what brought her awareness of EMDR and bilateral stimulation. Interesting. This is another one most people are aware of, the progressive relaxation, the clench and release. I use it, but it's a lot of people are kind of familiar with it. But these become much more powerful when they're used in combination rather than individually. One thing, of course, is the body scan, and that's lying down and relaxing and letting your awareness flow through your body from head to foot, much like we did in that light stream meditation, and just being conscious of your body and the processes that are going through. But here's a way of putting it all together in a way that can be really powerful and effective. This is the relaxation and anchoring technique. It's another form of progressive relaxation. I find that it's more helpful for people who come from the experience of trauma. It promotes an awareness of the internal energy flow within your body. It also utilizes the polyvagal theory and the sensory motor technique of interoception, of becoming acutely but mindfully aware of my internal body state and processes. Now, anchoring is something that's derived from neurolinguistic programming. It's not something that I made up. One definition is it is a visible outward sign of a deliberate inward shift. We all use anchors all the time. We just don't call them that. Things like in certain religious traditions, making the sign of the cross, folding your hands when you pray, washing your hands if you're Muslim, putting on a prayer shawl if you're Jewish, putting your hand over your heart when you do the Pledge of Allegiance or saluting the flag. All of those are visual outside reminders that I've made a deliberate inward shift. There's a thought that's coming to me, and it'll be here in a second. What an anchor does is it kind of cuts out all of the intermediate steps. It's kind of like the shortcut on your computer desktop. I mean, you can type in C:// in the file path, or you can click on the little thing that looks like a piece of paper. There's your word processor. It just cuts through all of the intermediate steps and brings it right to the forefront. So the type of anchor that I like to teach folks, I mean, anything can be an anchor. The one that I like to teach folks is fairly simple, and it's really kind of innocuous. Nobody would necessarily notice that you're doing it. And that is to simply take the hand that you write with and just very gently circle the wrist of your other hand. Don't squeeze till your nail beds turn blue. This is not about pressure. This is about a conscious awareness of emotion. And so that's the anchor that I like to teach folks. And so for right now, what I'd like to do is I would like to take you through a relaxation and anchoring exercise. It's going to take us 12 minutes, something like that. So what I would invite you to do, this will work best if you're sitting in a chair with your feet flat on the floor, or perhaps if you are sitting on the floor on a cushion. What I would invite you to do, oh, and by the way, you are going to be completely awake and aware at all times during this exercise. You'll be completely aware and in control. I'm not going to have anybody hop around the room and balk on one leg and balk like a chicken, as much fun as that would be. You'll be completely awake and aware at all times. If at any time it starts to feel unpleasant, or you start to feel flooded, or you start to feel anxious, just open your eyes. You're completely in charge of your participation in this process. So with that said, allow yourself to feel the presence of your body in the chair or on the floor. Sit mindfully. Okay. Give in to gravity. We spend so much of our lives fighting the embrace of Mother Earth. Sometimes it's good just to relax and to be safely and calmly supported by the ground of our being. So now I would invite you to let your attention turn to your feet. And even though I know it sounds silly, invite your ankles to relax. It's almost like there's a little valve in there that when you open it up, lets any excess muscle tension or muscle energy in your calves just kind of melt and drain away down through your calves, down through your ankles, and out through the soles of your feet. Invite your knees to relax and let the extra muscle tension or muscle energy in your thighs and your legs just drain away down through your thighs, down through your knees, down through your calves, down through your ankles, and out through the soles of your feet. You know, we all carry more muscle energy around with us than we probably need at any given moment. So it's okay to let some of this go. I mean, don't worry, if you need it, it'll come back. But just for right now, allow yourself to experience the joy of relaxing your hips and feel how the whole bottom half of your body is just calmly and deeply and safely relaxed. Now, let your attention turn to your abdomen, to your trunk, to the main part of your body. Now, besides muscle energy, we carry lots of feeling energy in this part of our body. The place that most people are aware of is the solar plexus, that little knot, place up under the notch in your rib cage. That's the spot where fear and anxiety live. But also about 3 inches below your navel, down below your belt buckle, is the base of the vagus nerve. And that's the spot where shame lives. It's that sinking feeling in the pit of your stomach when you know you've been caught. So if there's any extra muscle energy or feeling energy in that part of your body, just allow that to kind of just melt away and drain away down through your whole body and out through the soles of your feet. Relax your chest and your rib cage. We tend to carry kind of sadness and depression in that part of the body. That kind of collapsed feeling that we get. And also right around the heart, the pericardial ganglion, is where we experience the sensation of hurt or betrayal. So if there's any muscle energy there, or any feeling energy, just let it drain away down through your whole body and out through the soles of your feet. And now let your attention turn to your arms. And like we did before, invite your wrists to relax and feel how the extra muscle energy in your forearms just drains away down through your forearms, down through your wrists, down through your hands, and out through your fingertips. Relax your elbows and feel how the muscle energy and the tension in your arms just drains away down through your arms, down through your elbows, down through your forearms, down through your wrists, and out through your fingertips into that endless sea of energy that surrounds us all the time. The energy is always there when we need it. We don't have to carry it all around with us. Okay? And now relax your shoulders. Oh, we carry the weight of the world on our shoulders. Just for a moment, let the world carry your weight as you relax. Relax your shoulder blades, the back of your neck. That's the spot where anger lives. The tension in the back of the neck. A lot of headaches have anger on them. Relax the front of your neck. That's one of the places where sadness lurks, that kind of lump in the throat feeling that we get. Relax the muscles in your face. Oh, we carry so much worry in the muscles of our faces. Just allow that extra muscle energy to drain away. And then finally, even though I know it sounds silly, invite your scalp to relax. It's almost like standing underneath a warm shower that just gently washes down over you and carries away any lingering muscle tension that starts to creep back in. And now, let your attention turn to your breathing. Now, don't try and breathe any special kind of way. Just become aware of the rhythm of your breathing. And without my saying anything about it, it's gotten slow and deep and regular. So if you'd like to relax even a little bit more, what you could do is you could allow your breathing to become even slower and deeper and more regular. This is the body's natural calm down mechanism, and we can use it anytime. It's always available to us. In fact, I'd like to remind you of a miracle that you discovered on the day that you were born. With the very first breath that you took in this world, you discovered the miracle of the life-giving energy that comes in through your breath. And that energy goes to every single cell in your body. Every single cell of your body is nourished and caressed by that life-giving energy that comes in with the oxygen in your breath. And also your breath can carry away some of the toxic byproducts of metabolism, the natural byproducts of being alive. So what I'd invite you to do is to keep lowering your breathing until you find a spot that feels just about right. Now, one of the things that sometimes happens, I should have mentioned this before, but sometimes what happens, particularly people who are addicted to stimulant drugs or people who are coming from the experience of trauma, they seem to get to a certain spot and they just kind of bounce. They can't seem to get very much further. That's okay. It's okay. That's exactly the experience that you were supposed to have today. But as you do that, just allow your breathing to become slower and deeper. And when you find a spot that feels just about right, physically relaxed, mentally alert, if you want, you could activate that anchor that we talked about by taking the hand that you usually write with and just very gently circling the wrist of your other hand. And notice how, with just the very slightest pressure and a deep cleansing breath, just sink into the hammock of your breath. So just be with that experience for a moment. Just allow yourself to kind of savor that experience. And whenever you're ready, I would invite you first to thank yourself, maybe for trying something that's a little bit different. And then just allow yourself to open your eyes and drift back into this place and this time. This is a wonderful gift that we can give to ourselves anytime, anywhere, with just a simple squeeze and a breath. Cool. Okay. So EFT tapping, they call it emotional freedom technique. I'm not crazy about the word. As a matter of fact, when I first encountered this, it struck me as being kind of woo-woo. But as I did more research, I discovered that it's actually based on the ancient Chinese meridians, and it's a form of acupressure instead of acupuncture. It doesn't use needles. This has been popularized by Nick Orton and his family, Dr. Dawn. There's by the way, lots of good research. In the short video, I'm going to interrupt him for a second. There's lots of good research out there about EFT tapping, acupressure tapping, and the effectiveness that it has. Not all of the research done by Dawson Church, by the way, who's the guy who kind of popularized this, but there's lots of other research besides his. And so it's been popularized by Nick Ortner and Jessica Ortner and that family. Here's a very brief introduction to it. There is a copy of the acupressure points that you see here in the handout materials. This is a pretty short explanation, but I invite you to pay some attention.
So tapping, otherwise known as EFT or emotional freedom technique, is a technique that combines ancient Chinese acupressure and modern psychology. And we call it tapping because we are literally tapping on endpoints of meridians of our body while saying certain statements. It's certainly a funny looking technique. I felt it was funny and strange when I first discovered it, but it is so powerful on everything from pain relief to financial issues, to weight loss issues, to limiting beliefs about yourself, about your life, to just overall stress. Tapping is proving to be extraordinarily effective. And it works. What the latest research has shown is that it works because as we tap on these endpoints of meridians, while focusing on the stressful issue, the challenge, whatever's going on in our life, we actually send a calming signal to the amygdala in the brain. The amygdala is that very ancient fight or flight response center in the brain. So we are in essence desensitizing ourselves to the stress, turning off that amygdala, turning off that stress signal, rewiring the way the brain works, the way the limbic system reacts, the way the whole body reacts to the stressful challenge. So let's have a very quick experience of it. 3 steps. Step number 1, identify what you want to tap on. One of the first ways to get started, the easiest ways I find, is to pick a physical pain or tension or stress in your body. So if your back hurts, pick that. If your shoulders are tight, you can roll around your neck and see there's some tension there. Pick whatever's going on in your body. And we've identified what we want to tap on. And if it's nothing physical, pick stress. Pick something that's bothering you specifically, something you're angry about, something you're frustrated about. So we have our target, then we give it a number on a 0 to 10 scale, 10 being highest in intensity, 0 being not there at all. So you'll say, I have back pain, it's at a level 7. And then we're going to do some tapping on it. Now we're going to use very general language just to guide you through the process, and you can just repeat after me. As long as you have the intention to focus on your specific issue, you'll get the results you want. So we start by tapping on the side of the hand. It's called the karate chop point. One hand taps on the other. Doesn't matter which hand you use, whatever feels comfortable, and repeat after me. Even though I have this stress in my body, I deeply and completely love and accept myself. We're going to do that 2 more times. Even though I have the stress in my body, I deeply and completely love and accept myself. And last time, even though I have all the stress in my body, I deeply and completely love and accept myself. Now tapping through the points. The first point is the eyebrow point, inside of the eyebrow, right where the hair ends and it meets the nose. Just tap 5 to 7 times and say, this stress. Side of the eye, not at the temple, right next to the eye, one side or both sides, this stress. The meridians run down both sides of the body. Now under the eye, this stress, so you can do one hand or the other hand or both. Under the nose, this stress. Under the mouth, above the chin, below the lip, right in that little crease in there, the stress in my body, 3 points left. Feel for the 2 little bones of the collarbone. Go down an inch, out to each side about an inch. You can tap with all 10 fingers of both hands, all the stress in my body. Now underneath the armpit, 3 inches underneath the armpit, right on the bra line for women, either side of the body, all the stress. And now where we look like monkeys, right at the top of the head, all the stress in my body. And we take a deep breath and let it go. And that is one quick, super quick round of tapping. The process is checking back in. What happened? What did you feel? What shifted? What's come up next? And continuing the tapping process until you get the relief that you want. Have a great day and keep tapping.
Okay, so another technique that derives from EMDR is called resource tapping. This is done by Dr. Laura Parnell, who is a very, very famous and very skilled EMDR clinician and trainer. She's got tons of YouTubes on her various techniques. This one I find particularly useful, and I think the reason that it works, she doesn't go into as much detail, she just knows that it works. I think the reason that this works, and particularly for things like chronic pain and irritable bowel syndrome and some of those stress-mediated disease processes, what it does is that it uses the EMDR concept and the relaxation. So what it does is, using breath work and mindfulness, we get the 3 parts of the brain stem, the limbic system, and the cortex, all oriented vertically up and down. And the bilateral stimulation, she uses a lot. She uses the butterfly tap a lot. The bilateral stimulation gets the 2 hemispheres coordinated horizontally. So now we have the entire brain oriented in both directions and able to process incoming information differently. There is a handout in the handouts that has a script for it. I'm not going to go into it here because it's a little bit longer than we have time for here. As we kind of wrap this up, having an awareness that mindfulness really restores balance. It takes the 5 elements of our human experience, the cognitive being, restructuring our experience without the need for judgment. Our social and family being able to tolerate the distress that inevitably, and the vulnerability that inevitably comes with any relationship that's worth having. The spiritual being that feeling of being connected and somehow finding the strength to move towards my valued ends, the things that are important to me. Recognizing that my physical being, including my nervous system, I have trauma. Trauma doesn't have me. And then our emotional our emotional life, our internal emotional life, using relaxation and self-regulation. And here is our friend having an aha experience as a result of using all of these things together. Great quote from Jon Kabat-Zinn: "You can't stop the waves from coming, but we can learn how to surf." I don't know if that's where it comes from, but of course there is in DBT, there's the concept of urge surfing, and in drug and alcohol, the idea of serving, being able to surf through cravings by getting up on top of them and not being overwhelmed by them. Okay, so here's a question. One of these techniques might be new to you, and I'm wondering if there are any new techniques of these that you might be interested in incorporating into your practice. If you do, there is lots of information out there. If you contact me, I'm happy to direct you to some resources that I know. If you have any need for training around some of these specific techniques, I'm certainly available to be helpful with that. Here are some resources for further exploration. My Grandmother's Hands by Resmaa Menakem is just a very, very moving and effective look at the ways in which intergenerational and historical trauma shows up in our African American brothers and sisters. Very, very powerful, very easy reading, and a very hopeful book. The second one is one that I've not read. I'm not as familiar with this, but looking at Wounds into Wisdom, looking at intergenerational trauma in the Jewish people, going back many more generations even than the African American experience, going back into Europe in the Middle Ages, and how the epigenetic alterations in how these genes are expressed. It doesn't, this is important to recognize, the epigenetic piece doesn't change the genetic makeup. Okay, it doesn't make people who have who have genes for blue eyes suddenly have brown eyes. One way of looking at it is it does teach people who have blue eyes how to hate people who have brown eyes. There are a number of books that have come out recently about the Native American and Alaska Natives and other indigenous peoples, including the Maori in New Zealand and Aboriginals in Australia, and how the historical trauma that has been visited on those people for generations, how that is showing up today in the behavioral health field, and also in chronic diseases like diabetes and high blood pressure and susceptibility to COVID. Black, brown, and red people have been disproportionately impacted by the COVID pandemic. And the fatality rates because of social determinants of health much higher among those populations. Some more manuals, some more books to look at. I particularly like Moving from Trauma-Informed to Trauma-Responsive Care by Stephanie Covington, who's a psychologist. Very, very powerful stuff. Not inexpensive, but worth every penny to get it. Mindfulness-Based Relapse Prevention by G. Alan Marlott, who died not too long ago, about a year ago. Mindful Self-Compassion. More things now. Thomas Hübl is another person who is becoming very well known for his work around intergenerational trauma. These are a couple more books, two by Jon Kabat-Zinn. Coming to Our Senses is one that I particularly like, and the other one, Wherever You Go, There You Are. Tara Brach, a psychologist, has some wonderful stuff on radical acceptance and mindfulness. Very, very effective, and lots of good meditation stuff. For dummies like me, there's even a text for us. This is something that I make you aware of, but I'm not recommending it because I haven't really researched it for myself. But this is an online course that runs for 4 weeks, 8 sessions, that combines mindfulness with some other elements of therapy. So I want to thank you for your attention and your participation today. If you have any questions, please feel free to contact me. And I will be happy to be helpful if I can. If you're interested in more training, you can reach me through the STEMS Institute. There's my email address. Finally, if you have any thoughts about it, if you wanted to share with me whether you thought the training was useful, including if you didn't find it useful, and perhaps if you have any feedback that might have made it more valuable for you, I'm always eager to hear that, because I take that feedback very seriously to try and improve the experience that you have. Unfortunately, this is not approved for distance delivery for continuing education. However, if you're interested, I can do a live presentation for your staff for you and your staff, if you would like, that would actually be available for CE credits. So feel free to contact me if you would like to do that. So I want to thank you very much, not only for your attention today, but I also want to thank you for bringing hope, help, and healing to the people that you serve. It is wonderful, life-affirming, often life-saving work that you do. If you want to get in touch with me, this is how to do that. I'm always available to do training. As I said, this is a NADAC approved education provider. Anything that you would, we have probably, I think at last count, about 40 specific trainings on various behavioral health topics that are available to be helpful to you and to your people. So I want to thank you very much. And with that, I'm going to stop my screen sharing. And I want to thank you again, and I'm going to sign off now. Thank you for your time and attention.